Hello, Calaveras County. I'm Mike Taylor, and the doctor is in. Dr. Randall Smart, that is. Dr. Smart, good to see you.
Good to see you, Mike. Thank you for having me today.
Oh, you bet. Now, this time, ladies and gentlemen, we're going to get healthy, but we're going to do it without doing something that I bet you think you should be doing, and that is taking vitamins.
That's exactly right, Mike.
What are vitamins, Dr. Smart?
So vitamins, as we know them, have not been around that long. They were discovered in the 1920s, 1930s, less than 100 years ago. Mm-hmm. And what the biochemists found out is there were these organic compounds that were necessary for survival. And the other criteria was that your body isn't able to make those. Mm-hmm. So there were these substances that nature makes, other animals and plants make, that we can't make, and if we don't get them, we don't survive. Mm-hmm. And so, kind of interesting, initially they were related to a chemical structure called amines, which is a nitrogen-type structure. So they were called vital amines because they were vital to life and they were related to nitrogen.
Okay.
So vital amines is what they called them in the 1930s, and somewhere along the line they became vitamins.
We got lazy as usual and strung it together.
So they've been around less than 100 years. They have an interesting history. Certainly there are diseases caused by vitamin deficiencies. But what's more interesting to me is it seems within the last 10 years, Americans, including Calaveras County, have been very interested in health and longevity and self-care. And so they're much more willing to take vitamins in large quantities and with the belief that that's a good thing for you and that they're making themselves healthy. And that's not always a good thing, Mike. Sometimes they can be harmful, and sometimes you need some medical guidance. So just the stigma of vitamin being good is really a little bit flawed.
So it's one of those that comes with a caveat. They are good when you're using them properly, I would imagine.
Right, that's exactly right.
So how do you determine, and maybe that's our first question now that we know what vitamins are, is how does someone know maybe they should be taking some extra vitamins here or there? Well,
really good question. There are groups of people that are more at risk for vitamin deficiencies.
Okay.
And actually of interest, the Western world, like the United States, is known to have more vitamin deficiencies than the rest of the world.
That's because of our crummy diet, isn't it?
Well, it may be because of our good diet, the fact that we have so many vegetarians and so many people that have gluten-restricted diets. And so it may be because we can make those choices and other countries can't. But it seems a little more prevalent in the Western countries. But when you look at the United States, the groups that are more susceptible to vitamin deficiencies are the older patients, the older citizens, the people that have had gastric bypass surgery. And there's many people that have had gastric bypass surgery. I mentioned the vegetarians, the vegans. They are much more susceptible. Pregnant women are more susceptible.
Is that because the developing child is sapping her system?
Yeah, that would be one way to think about it. It's because that developing child and fetus will need those vitamins and uses those vitamins and can actually be harmed if those vitamins aren't available for the fetus.
So I'd imagine that's definitely a case where you're talking with your doctor about, and I'm sorry, I'm kind of skipping around a little bit. Is there any way for the medical profession to diagnose other than sort of symptomatically? But I mean, is there a blood test that tells you, oh, you're deficient in these vitamins, or?
There are blood tests. They're used very commonly now,
Okay.
and they're probably misused more than they're used correctly. And so blood tests are used to define what's normal. So go with me here a minute.
Okay.
Let's say we want to know what a normal weight is. And we weigh everybody in this country and we decide normal is 220.
Okay.
Because that's what the average American weighs. Well, is that the best weight for your health?
Probably not.
Not. So the same thing with vitamins. We can measure vitamin levels, but that doesn't mean that's the best level for your health,
Okay.
optimal health. And so as a rule, measuring those levels across the board, just to check, is really discouraged. That's really a bad
Okay.
idea because we actually don't know what normal is.
Yeah.
And we don't know what to do with those levels when we measure them. Now, there are definitely circumstances where we do that, where we know people are malnourished, or we know somebody has bone loss, or we know, but those are targeted groups, and those groups should have certain vitamin measurements done. But across the board, it becomes confusing and probably not a good use of money or blood or medical resources.
Okay. So where do we kind of start with thinking about vitamins? How do we know, everybody thinks, especially talking about the past 10 years, we've almost been advertised into believing that you've got to be taking a multivitamin and you're probably taking some vitamin C and you may be taking this or that when you feel like you're coming down with a cold or a sore throat or something. So where do we go with all of this?
So these vitamins that people need are only needed in very small amounts as a rule, not large amounts. Most of that is gained from a proper diet. In fact, all of it is gained from a proper diet.
Sure.
So if you're paying attention to what you eat, you probably don't have any vitamin deficiencies. If you're an alcoholic or you're homeless or you're older, then you may have some. But if you're on a balanced diet, like you and I probably are, you're probably fine. And you can start there. And the question is, do people need a multivitamin every day? I think that would be a pretty common question. That doesn't cost a lot. Now, nationally, we spend something like $5 billion on vitamins. But to take a multivitamin every day may cost the patient $15 a year. So it doesn't cost a lot. Probably not harmful. But if you're eating the right diet, you probably don't need that.
Don't need them, okay.
Now, the people in particular that ought to pay attention to that are the vegetarians, people who are consuming too much alcohol, the pregnant patients, of course, to talk to their OBGYN doctors. And probably as people get older, which we'll define as anybody older than me, they should probably be taking multivitamins every day. But they don't need to take a jar full or a handful or spend a lot of money. One multivitamin is ample for what they need.
What about children and, the flavored chewable multivitamins that they market pretty heavily because they taste so good?
Right. So I'm not a pediatrician, but my understanding is same thing, Mike. Balanced diet.
Okay.
Now, there are components of American diets that have more vitamins and better vitamins. A lot of vitamins come from animal products, hence the vegetarian problem.
Yeah, that's what I was...
So eggs are replete with essential vitamins, and in particular egg yolks. So for the partial vegetarians, if you will, that could be something that would help them. Meat products, of course, are loaded with vitamins. Chicken, fish, beef. So those could be used in small quantities. And there are the leafy green vegetables have a lot of B vitamins. Wheat germ has vitamins, and wheat germ could be used by vegetarians.
Okay.
So But again, back to the children, if they're on a proper diet, and the parents could check with the pediatricians, they really
probably don't need them.
They don't need them.
Okay.
They just don't need them.
We, you mentioned the $5 billion a year on vitamins. Does that include supplements?
No.
Because supplements is a whole different animal altogether, isn't it?
You know, supplements and herbals is a huge multi-billion-dollar industry. I don't know exactly the numbers, but I think they are on the order of 15 billion a year. And I don't criticize the patients for taking those supplements. Practicing medicine is in some ways like having teenagers. You really have to choose your battles.
Okay.
And so I don't fight with the patients that take supplements unless I think they're really doing something wrong.
Maybe they're overdoing it.
Most of those supplements I don't really believe have a health value for the average patient. But it's interesting when they come in for appointments or checkups, they may have one or two prescribed medicines, like a blood pressure medicine and a cholesterol medicine. And then they have 10 to 15 supplements and alternatives they take. I mean, a long list. Some of those can be harmful. Most of them we don't know a lot about. It's very expensive to do that kind of research, millions. To investigate one medicine would be on the order of $20 million.
Goodness.
So we're chipping away at it. Our science colleagues are chipping away at it, but the supplement industry is absolutely huge.
Yeah. And it's just this side of completely unregulated.
It is completely unregulated.
Yeah.
It is.
So you're kind of, and not to be, not to make light of it, but you're sort of buyer beware, taking it at your own risk.
Sure, absolutely. So you can say, well, I'll try a little CoQ10. Oh, and over on this shelf is some flaxseed. I think I'll try a little flaxseed, and maybe I'll throw in some rose petals over here. And we don't really know what health benefits there are from that. I doubt that there's a lot.
Well, we had the ginkgo biloba craze, and then we glucosamine and chondroitin. Does that do anything? That's one of those that I would especially think the aging community would be interested in because of joint disease and whatnot. Is there any proof that those help?
So there have been several studies about glucosamine. The best glucosamine chondroitin does is on par with Tylenol.
Okay.
Now, that's better than placebo, because Tylenol or acetaminophen does a lot more than placebo. So it does help, and it does benefit, but not much more than Tylenol.
Okay.
But you could take Tylenol and say, well, that's not really helping, and then you could take glucosamine and say, my knees actually feel better. I think I like it. As far as I know, Mike, there's no harm from glucosamine chondroitin.
Okay.
And ginkgo, I believe, had to do with memory, if I remember right.
Yeah. Yes.
And my understanding is there's no memory benefit at all.
Okay.
I'm not sure there's any harm from ginkgo, but there's no memory benefit.
Well, and I think that's part of the I guess I'll call it an overriding mindset. People think it's herbal, it's natural, so I can take it,
it's good.
Take it as much as I want.
So foxglove is herbal and natural.
Yeah.
If you eat that, you'll die. Hemlock, that's
Same
herbal.
thing.
That's natural.
Yep.
If you eat that, you'll die.
You'll die.
So herbal and natural doesn't imply safety. I mean, it just doesn't. I mean, there are mushrooms that can be delicious, and there are mushrooms that can be rapidly fatal. They're all natural.
Yeah,
Right.
That's true. Good
So
point.
there is I think a misperception that natural is better. I don't really share that opinion. I don't agree with that, but I don't fight with the patients a lot. Because you have to think of it. They're trying to improve their health. They're doing something on their own. It's a proactive thing that costs them money. I mean, you don't want to discourage them from being interested in their health. You just don't. And like I say, you choose your battles.
What about the vitamin, is it B12 shots?
Great question. So vitamin B12 is a very important vitamin. And it has kind of a very complex way of entering your body. It is originally broken down in the stomach. It's connected with a specific protein you make. It's circulated through your gut and all the way around near the appendix. There's another set of tissues that absorb it, and all those things. There's 5 different things that have to happen.
Oh, wow.
For B12 to be absorbed. And many times those 5 things don't happen, particularly as people age. So the most recent numbers I've seen are something like 20% of our older population is B12 deficient.
Oh, wow, okay.
Now B12 deficiency is not a subtle or harmless problem. It can create an anemia that can be debilitating.
Oh,
anemia
okay.
being loss of red blood.
Mm-hmm.
It can also create some neurological problems. Tingling and numbness in your fingers.
Oh, okay.
Or in your feet that people don't understand why they have, and even spinal cord problems. So B12 deficiency is pretty common, and it can be disabling. And it is very treatable. Now, most people do not need B12 shots.
Okay.
Some do, but most people do not. Most people who are B12 deficient can overcome the deficiency with oral B12 pills.
Oh, okay.
And they come in about 1,000 micrograms per pill. And those can be bought over the counter, like everything, and taken as 1 or 2 a day. And there's absolutely no harm from that. Any excess B12 that gets into your system is simply excreted through the urinary system.
Okay.
So so you can't overdose or become toxic on B12. But the way the medicine part of B12 works is if you were to come into my office and say, I've got some numbness or tingling in my fingers, what do you think it might be? Well, among the things we would do is test your B12 level. That would be one of the times we target somebody and test their B12.
I was going to say, is this a case where you test?
Right.
And it is. Okay.
And if it's low, and many of them are, we'd say, okay, let's put you on B12 pills. You buy them over the counter. We'll recheck it in a month or 2. And if we recheck it in a month or 2 and it's back to normal, we're done.
We're good.
That's all we need to do. Now, of interest, there is a disease that is historical, but it's also current, called pernicious anemia.
Okay, I have heard of that recently.
And pernicious anemia is B12 deficiency. And it was a fatal disease in the 1800s. There was no treatment that anybody understood. People died from it. And ultimately they realized it was from B12 deficiency. But what happens in pernicious anemia is your immune system prevents that protein in your stomach from working.
Oh.
So it's an autoimmune problem. And there's some interesting history behind that, but the protein in your stomach isn't able to absorb B12. So it doesn't matter how much B12 you take, it's not going to get absorbed. And those people should have shots. And the shots.
So that actually introduces the B12 in a slightly different format, I guess I'll say, that the body that isn't absorbing the pill can absorb what's injected.
It's injected. So when it's injected, it rapidly enters the bloodstream and it no longer needs to be absorbed by the gut or the stomach. But in people with pernicious anemia, we'll give them shots every day until they start to turn around, and then every week. But a normal B12 shot regimen would be really like once a month.
Okay.
So people aren't injecting vitamins every day normally. They inject them about once a month. It works. It's inexpensive and it's easy.
And is that something that has to be prescribed by a physician? The shot of B12?
It does.
Okay.
Right. That is a prescription.
How about vitamin D? We our bodies absorb it from the sun, but
Right.
we're not supposed to be in the sun
Right,
for
right.
prolonged periods. So
And-
that sounds to me like an interesting tightrope to have to walk.
So vitamin D is also a very beneficial vitamin as far as we know. There are some harmful vitamins, Mike. Vitamin E, which was trendy 6-8 years ago, is related to heart failure, is related to respiratory infections. Vitamin A has a relationship with lung cancer
Oh, goodness.
and hip fractures. But vitamin D is not a harmful vitamin. Vitamin D is about bone metabolism and is manufactured in the skin, related to sun exposure. It's interesting. When we started this, I said the body can't make any of these vitamins. Well, vitamin D is the one it can
Is
make.
the one we can
It's
make.
the exception. And if this was a medical school test, that would be on the test. But vitamin D is helpful. We're still exploring how much vitamin D for which patients, but what we know the most about is bone metabolism, and that people who have poor bone metabolism, or what we call osteoporosis, which is bone thinning,
Okay.
often will have low vitamin D, and supplementing their vitamin D can be really beneficial for bone health and preventing fractures.
Well, vitamin D milk.
Vitamin D milk, exactly.
They add it to milk. Now,
Do you know where that came from?
No.
That came from a disease called rickets.
Oh, okay.
And there's a lot of history in vitamins, like scurvy.
Scurvy. I was going to ask
Vitamin
about
C.
that from elementary school
Right,
and learning
scurvy and
about
vitamin C, but-
sailing the ocean blue.
But it turns out back in the 1940s, 1950s, we had a lot of children who had bowed legs.
Oh.
And that was a disorder called rickets. And it was disabling, and much of that was related or thought to be related to vitamin D deficiency. Now it's a variety of different things, including low calcium and some metabolic disorders. But what they wanted those kids to do is drink more milk because it had the calcium in it. And so calcium and bone is good, and let's throw in some vitamin D. So that's why the milk has the vitamin D in it now.
Okay. So we cured kids as they were drinking milk with lunch at school.
You don't see a lot of rickets anymore.
Not anymore.
No, or a lot of scurvy.
I was going to say, do we see much scurvy? We don't seem to hear about it.
No, you can see it in third world countries where people
Okay.
are really malnourished and starving. And I've been to those countries, and I don't believe I've ever seen a case of scurvy. Scurvy is usually bleeding gums, sore joints, poor healing, nothing heals.
Okay.
I'm not sure I've ever seen a case or recognized one if I did. But scurvy was described really with the English sailors in the 1800s. And so these sailors would get on these 1- and 2-year journeys around the globe. And some of them were whalers, many of them were sailors with the armed forces, with the British Navy. But they would get scurvy, and it would be fatal. They would die from scurvy, and they usually had ship doctors or ship medics who would recognize it. Well, ultimately they started putting limes on the ships.
It goes with the rum.
And it helps the scurvy. And ultimately, British sailors were referred to as limeys.
Limeys, that's right.
Because they had the limes on the ship that prevented the scurvy. But some of the vitamin deficiencies, particularly historically, were fatal diseases like pernicious anemia, scurvy.
So yeah, not having vitamins in your system can be very dangerous, but it can also be dangerous to have too much of them also. Correct?
Absolutely.
So in that thinking, does that sort of say don't take a multivitamin if you're, in sort of the median adult age, you haven't hit your late 50s and early 60s? Or do you then speak with your doctor about, where are my levels and do I need vitamin D? Do I need
So it
B12.
never hurts to talk to your provider and about vitamins or vitamin deficiency. Most people in this country, and certainly Calaveras County, don't need vitamins. But the vegetarians, vegans do, the older people probably do. The pregnant patients should talk to their gynecologist, but they probably do, obstetrician. But what concerns me is so many people are taking megavitamins now, very, very trendy. So they'll take thousands and thousands of milligrams of vitamin D or E or A. And so far, what we know about that is it's a dangerous practice that is really hard to track.
I can imagine.
It's hard to track. It's hard to report. So I could have a patient come in with lung cancer next week, and they have a tobacco history. Well, nobody really attributes that to vitamin A megadosing.
Sure.
So even though we know there's a relationship, nobody is really in practice monitoring that or reporting that. But I have a lot of concerns about people that are taking these megavitamins. I don't think they're helpful. I think they're potentially harmful. And I think it's a practice I would discourage. I would encourage them to have a good, balanced diet. If they're a true vegan, to take a multivitamin every day, and maybe in those patients even measure their levels to make sure they're getting enough vitamins.
I was going to say, it sounds like this is one of those battles that you would take on.
I would.
With a patient who's,
right.
I'm going to use the word, overdosing on vitamins and causing themselves more harm than good.
Exactly.
So maybe a little bit of a good thing is still a good thing, but you definitely don't go crazy with it, it sounds to me.
I mean, the concept that if one vitamin is good, then 10 will be great, and 20 will make me strong again.
Make you Popeye.
is really flawed.
Not going to work.
I mean, that just doesn't work.
So basically, it sounds like we can save some money. Since we're down to our last minute here, we can probably save some money and not take multivitamins, not take supplements, until for sure we've spoken with our doctor and figured out exactly where we are.
I think that's good advice, Mike. In addition, I would say eat a good, healthy diet.
Yep.
These diets are on the Mediterranean diet is a great diet.
Okay.
Easily accessible. The American Heart Association, great diet.
Says go for it, and that means we're going to be healthier because we've listened. So keep listening, Calaveras County, and join us next time when the doctor is in. Dr. Smart, thank you very much.
Thank you, Mike.
We'll see you folks next time. Enjoy.